Okay, let's unpack this. We spend so much time dissecting the systems we live in, the policy arguments we're always having. And sometimes the problems, they just feel like gravity. They're
Hmm.
just these heavy, unavoidable messes that exist in the world.
That's a completely natural feeling. It really is, especially when you're just stuck in one policy environment, say, looking only at one country's drug crisis.
Right,
But that focus has a massive blind spot.
right.
So our mission today is to deliberately widen that lens. We're using this whole stack of international sources to ask a pretty crucial question. Are these messes actually unavoidable, or are they maybe specifically designed that way?
Exactly. We're looking at global approaches to things like drug use, sex work, migration, to see if anyone's really cracked it or if different choices just lead to different kinds of mess.
Right. Because if every government, regardless of its policy, ends up in the same difficult, expensive, harmful place, then maybe it is an unsolvable problem.
But I'm guessing that's not what the data shows.
Not at all. If some countries are doing measurably better, or, and this is maybe more important, managing the predictable harm more effectively and for less money, then the problem isn't human nature, it's system design.
Yeah.
And that's the core premise we start with. The underlying behaviors. People using substances, people needing to move for work, people engaging in transactional sex, that stuff isn't radically different across borders.
That's the constant. People are people. They respond to incentives. They look for opportunity. That part is consistent everywhere.
What's different, fundamentally, is what governments assume about that behavior. And that's the fork in the road for policy. Some systems are built on what we can call the elimination fantasy.
The elimination fantasy.
Yeah, the assumption that if you just apply enough pressure, enough punishment, the unwanted behavior will just vanish.
And the other path, the management reality.
That approach starts from the position that the behavior is going to persist no matter what. So the policy's primary job isn't elimination. It's managing the risks, reducing the harm, and keeping the behavior visible.
And that one difference in assumption fantasy versus reality is what determines if the whole system creates stability or if it just creates, self-inflicted chaos. Okay, let's jump straight in. First case study, and it's maybe the most studied drug policy. The sources note that the U.S. and most of Europe faced really similar shifts back in the 60s.
Right. Urbanization, youth culture, new substances appearing on the scene. The problem was basically a shared one.
Yet the policy response, especially in the 80s, just went in completely opposite directions. The United States went all in on criminalization.
Aggressively so. Mandatory minimum sentences, huge state investment in enforcement. I mean, this was the pressure will eliminate model in its purest, most expensive form.
And at the same time in Europe, several countries started to shift.
Right.
Portugal's the famous one, but also the Netherlands, Switzerland, they made a different design choice.
They decriminalized use. Not supply, but use and small possession. They shifted the whole intervention from the criminal justice system to the health system.
And it's so important to be clear about what Portugal did. They didn't just legalize everything.
No, absolutely not. They just changed the assumption about the user. If you were caught with drugs for personal use, you didn't go to jail. You went before this Commission for the Dissuasion of Drug Addiction.
Which was staffed by health experts.
Health experts, social workers. The system explicitly accepted that drug use persists and then designed a way to manage the harms that come with it.
And the results? I mean, they were striking. The elimination fantasy in the U.S. obviously didn't eliminate use, but the punishment system saw costs just spiral.
And the social consequences, particularly incarceration rates, were devastating. But then you look at the metrics in Portugal after 2001, drug use didn't vanish, no. But a massive amount of the associated damage did.
Like what specifically?
The rates of HIV and AIDS among drug users just plummeted. Overdose deaths, they stabilized and then started to fall. And the burden on the courts and prisons dropped significantly.
So this is the key takeaway for you, right?
It is. When the system treats the behavior as a public health issue, not a moral failing, the harm indicators reliably fall, even if the overall behavior persists.
I found that part of the research so compelling because it really tackles the political argument. Why do governments keep choosing the system that is so clearly more expensive and more complex?
Because the elimination fantasy is just easier to sell politically. It feels like taking action. We're tough on this.
Right. Tough on crime.
But the data shows that the punishment system just moves the costs around. From the policing budget to the hospital budget to the prison budget, the system just gets clogged and more expensive to manage. Same behavior, totally different outcomes, purely based on that one initial assumption.
Okay, let's transition to a different kind of behavior.
Yeah.
Sex work. And here again, you see that exact same divide. Is this a moral issue to be stamped out, or is it a labor and safety issue that needs to be regulated?
And just like with drugs, the outcomes of the moral approach, they are predictably, reliably bad. The evidence shows that when you criminalize it, fully or partially, the activity just gets pushed further underground. It doesn't disappear.
Which creates that dynamic we've started calling opacity. The government just loses sight of what's happened.
Precisely. And in that darkness, in that opacity, the power dynamic shifts completely. Exploitation goes up because workers can't go to the police without fear of being arrested themselves.
So violence goes up too.
Violence risk increases significantly, yeah.
Yeah.
The activity is totally unregulated. It's invisible to law enforcement except when they show up to make arrests. So the policy that was designed to reduce social harm ends up amplifying it.
And you contrast that with systems built around labor and safety. The sources point to New Zealand, which fully decriminalized in 2003, or parts of Germany.
Yes, and once you accept that the activity will persist, you can start to design for safety. The New Zealand system is fascinating. It basically treats sex workers as employees.
What does that mean in practice?
It means they have the right to refuse a client. They can demand safe working conditions. They can report crimes to the police, violence, exploitation, without the fear that reporting it will lead to their own prosecution.
So the behavior is still there, but the system is actually designed to immediately surface any harm that's happening within it.
The mechanism is visibility, governability. The government isn't endorsing the activity, but it's refusing to endorse the huge social costs that come with hiding it. Because it's inspectable and regulated, conditions get safer, health access improves, and, well, it's just harder for organized crime to take control.
Because there's legal recourse.
There's legal recourse and visibility. The difference in worker safety metrics is just night and day.
Okay, our third case study, migration. This one really drives home the cost of that elimination fantasy. It shows the collision between the stated political goal, controlled migration,
Right.
and the system's actual messy reality.
This is where politics and economics just smash into each other. Governments promise zero tolerance, total elimination of unwanted migration, but the fundamental economic demand for labor, it persists.
Right. In care, farming, construction.
That demand does not care about border rhetoric.
So let's look at the deterrence approach first. The sources point to countries that leaned really heavily on making things hostile, tightening the legal routes over the last decade. So what happens when you limit those legal pathways, but the jobs still need filling?
You get a cycle of predictable, self-inflicted chaos. Legal routes tighten, demand persists, so the informal labor market expands to fill the gap. Exploitation becomes normal.
And the cost.
The enforcement costs surge, detention costs rise, and the whole system loses its ability to tell the difference between a legitimate worker, a refugee, and a criminal. It all gets murky.
So the policy says control, but the system actually produces that same opacity we talked about. The jobs get done, but invisibly. And the workers have no legal leverage. They're incredibly vulnerable.
The state literally loses the capacity to govern that part of its own economy. And this is where the managed pathways approach is such a sharp contrast. These are countries that chose to align legal routes with actual persistent economic demand.
Like Spain in the early 2000s.
Yeah.
They did these huge regularization programs. I remember that was really controversial. But what did it actually achieve?
It brought hundreds of thousands of previously undocumented, invisible workers into the legal economy.
It addressed the opacity problem head on.
Directly. Suddenly, that labor became visible, it became taxable, it became regulatable, tax receipts went up, and the government got a handle on who was working where. It didn't stop migration, but it made it governable.
Canada is another good example, right? With the sector-specific work visas.
Exactly. Again, it's not a perfect system, but by providing legal, time-bound pathways that align with real economic needs, you get higher compliance rates. Your enforcement costs are predictable because the system was designed for persistence.
So the crucial distinction here, and the thing for you to really get, is that these countries didn't solve migration.
No, not at all. They just accepted its persistence as an economic reality. And they created channels for that behavior to be visible, compliant, and therefore manageable. Where the elimination fantasy won, the behavior just went underground, which always increases vulnerability, chaos, and long-term costs.
This brings us to the synthesis then. We're connecting the dots across these three things that seem so different: drugs, sex work, migration. What does this international comparison consistently show us about policy design?
It shows that this isn't about, moral superiority or just copy pasting a system from one country to another. It's about fundamental physics.
Hmm.
We see these consistent, reliable patterns of system dynamics that hold true across every single issue.
And those two reliable patterns that keep coming up.
Pattern number one is the outcome of the punishment-heavy, elimination-focused system. These systems reliably hide the behavior.
They create opacity.
Yes. And hidden behavior concentrates risk, whether that's disease from drug use or violent exploitation or labor trafficking. And that concentrated risk dramatically increases your long-term unpredictable costs. It shows up as a public health crisis or a judicial backlog. It's the hidden price of that elimination fantasy.
And pattern number two, the acceptance or management design.
Right. Those systems assume persistence and they plan for it. They surface problems earlier, which lets you intervene more proportionately. You can use health treatment instead of jail cell or labor standards instead of silence.
So you reduce the extreme harm.
You reduce the extreme harm and, crucially, you stabilize and predict your spending. The system becomes less chaotic and, honestly, less expensive over time because the true costs aren't hidden until they become a catastrophe.
And this is where it gets really interesting for me. When you have different policy assumptions reliably producing such different patterns of harm and cost, well, the resulting mess stops being an accident. It's not bad luck anymore.
It becomes a design choice.
It's a choice.
Exactly. The consistency isn't in the specific numbers, costs will vary, but purely in the direction of the outcome. Designing for persistent human behavior leads to systems that are more manageable, more transparent, and, critically, less expensive in the long run.
So the policy that looks soft can actually be the most fiscally sound.
While the policy that looks tough often turns out to be a massive financial and human hemorrhage.
So what does this all mean for you listening to this? We started by asking if these huge policy problems were unavoidable. And I think the core lesson is, well, it's pretty clear.
It is. Policies that try to achieve that elimination fantasy for persistent behavior, they almost always end up just amplifying the harm and complexity they were supposed to solve.
And on the flip side, policies that accept the management reality tend to stabilize costs and reduce those really extreme catastrophic outcomes, even if the behavior itself is still a challenge.
Right.
So if we accept that some approaches reliably cost more in money, in lives, in social chaos, and yet they achieve less stability, then the discussion has to move beyond morality or political talking points.
The next step is just pure arithmetic.
Arithmetic.
We need to calculate the true long-term cost of these design choices. If we keep choosing systems that hide problems and increase risk, what non-monetary price are we paying right now in social capital, in trust, in vulnerability?
So think about that for a moment. What area of your own life or work, or the system you operate in, might benefit right now from shifting that core assumption? From trying to eliminate a persistent reality to simply designing for management, for visibility, and for predictable risk? That is the real deep dive that starts now.